So as you can tell, we have significant challenges in the global health system. And these challenges are specifically concentrated and chronic in low and middle income countries around the world. And when you look at the next level of detail, it becomes very clear that a lot of these challenges are related to infrastructure problems and supply chain problems. We've created a dedicated function we call the Global Impact Team. And it's a team that is focused in partnering with organizations like the USAID, the World Health Organization, the Bill and Melinda Gates Foundation, and working on very specific projects where we can leverage our skills, our technologies, our innovations to help address these issues. We did a very interesting project in Rwanda in partnership with the World Bank and the Ministry of Health in Rwanda. The problem we were dealing with is the distribution of blood all across the country. The characteristics of the supply chain of blood distribution is very, very complex. You're dealing with a very limited shelf life. You're dealing with a supply chain that needs to be temperature controlled. We also were dealing with an infrastructure in Rwanda that was fairly underdeveloped. So we partnered with Zipline and we designed a network that really allowed them to distribute blood on drones all across the country. It was a fascinating project where we used the fundamentals of all the mathematical decisioning we do with our customers in retail or manufacturing, but applied it to this problem here. All of this allowed us to create a network that today is being used very successfully all across Rwanda. As you can tell, there are significant challenges in the global health systems, and I think supply chain technology, supply chain competencies can significantly help resolve a lot of those challenges. We'd love to partner with other organizations where we can leverage technologies and positively impact those lives from a global health perspective.